Good morning, good afternoon, good evening. My name is Maxon, aka the Sharp Tutor. So I'm going to take you today in surgery under the topic amputation. So the content for this discussion is as follows. So we're going to define what amputation is. We're going to talk of the classification. We're going to talk of the indication for amputation. We're going to talk about the types. We're going to talk about the pre-operative and post-operative. We're going to talk about the prevention. We are going to talk about the complication. Yeah. So amputation, by definition, is simply the surgical removal of the limb or extremity. So a limb, we have the upper limbs and the lower limbs. The upper limbs, we're talking of the hands. The lower limbs, we're talking of the legs. Extremities, all it's just one and the same. Yeah, that's where there is limb or extremities. So some of maybe you may get confused, but you're talking about one and the same thing. And one and the same thing. So amputation is a surgical removal of the limb or extremity. So it is classified into two. It can be open or closed. Open is where you cut a limb and you leave it open. So sometimes can be due to infection, due to secondary infection that you suspect. Yeah, especially when the prognosis is poor. So you won't suture, you leave it closed. So you are going to leave it open. So you also have the closed one. Closed one is where you close using skin. So where you close the limb, where you cut, and then you close using the skin, where you suture now. Yeah. So what are the purpose for amputation? So first purpose to save life. It is to improve function. It's also to, 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 to provide relief from severe pain. These are individuals who come with pain because they have been in trauma. Yeah, that's trauma. So there's that pain that they undergo at that moment. Yes. So you're going to make sure that you give them painkillers. Yeah, you give them strong painkillers. Yeah, the morphine, pethidine. Yeah, yes. Okay. So we are also going to talk about the indications. So what are some of the indications for amputations? So this is when we talk about the 4 Ds of amputation. So the first D is dead. So dead, so it's when maybe someone has diabetes mellitus. That's one is an indication to amputate an individual. Diabetes mellitus. Someone has the dry gangrene, sickle cell anemia. Those are indications. There is dead. From there we have deadly or dangerous. So that's where we have now wet gangrene. That's where we have cellulitis, inflammation of the cells. This is where we have necrotizing fasciitis. So you amputate. Someone has those under deadly. So we have also dead loss. So dead loss is where someone has uh, contracture, severe contracture. Yeah, severe contracture. Someone has severe chronic pain. Yeah, we need to amputate. So contracts are mostly, for example, in late complication of veins, where you're going to find contracts as a contracts as a complication. Yeah. So from there we go on now on the last one, dead nonsense. So dead nonsense, uh, we can talk of polydactylia. So polydactylia is where someone someone is born with an extra finger. So that one is, we call it as dactylia. Someone has an extra finger. So you need to amputate, to remove that finger. That one is abnormal. A normal human being should have 5 fingers. If a person has uh, 6 fingers, that's polydactylia. You need to amputate to remove that finger. That's abnormal. Yeah, of course. Yeah, yeah. So you also have syndactylia. Syndactylia is where someone is born with fused fingers which are fingers that has been attached. Yeah, fingers that has been attached to one another. So you need to make sure you separate them. Yeah. So that's one is just an addition. Yeah. So from there, let's talk about the types of amputation. So we have disarticulation. This where you cut on a joint. We have below the knee, above the knee. We also have seams disarticulation, where you cut on the ankle. So we are done with the types. Disarticulation, below the knee, above the knee, seams disarticulation. So let's also talk about the preoperative of amputation. What are some of the things what are some of the things that you should do before you take someone for in theater for amputation? So you have to make sure that if someone is diabetes, you control the sugars. If someone has sickle cell anemia, you transfuse the blood. Post operative, so this is where now you do cares, where you give painkillers, then pain you give antibiotics, yeah, for prophylaxis. So let's also talk about the prevention. Prevention is why you encourage someone to be cleaning the wound every day. So what are some of the complications? Complication, we have immediate complication or early complications. This is where we have wound dehiscence. This is where we have uh, visual strides. Visual strides where we talk of the deep venous thrombosis. So this is where we talk of the stasis and the hypercoagulability. We are going to find these things uh, in intermediate complication. Late complications where we find severe chronic pain is where we phantom limb, where we find the uh, 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 scarring to the limb. Yeah. So we are done with amputation. These are the uh, simple things that you have to know as a student who is pursuing medicine, nursing, clinical medicine. Yeah. So you need to know these things. You need to know amputation, what amputation is, the indication, the types, preoperative, postoperative, prevention, complication, as simple as that. So if you have any question, you can Please comment and section.